has led strategic engagements with key stakeholders to drive collaborative initiatives in the areas of training, patient education, operations excellence, and digitization. As Assistant Director in Newcrest Berhad, she shapes the strategy to enhance the company's presence in Malaysia and Singapore market. Let's welcome Viva Sheikh.
Hi, Ellen. Thanks for having me here today. You guys are able to hear me loud and clear?
Yes, we can hear you and we can see you.
Okay, cool. So you are able to see my slides, yes? So let me just touch back on what Steve and David have mentioned about AI and the uses of it in healthcare, and just giving you some more example on how it can be incorporated in healthcare, the technology of AI. A little bit more about the company. So this is our influence and our presence. So we have been around for more than 7 years, and one of our specialties is actually IoT devices that is connected to our app, which is called Imedic. I will share a little bit more about it. So this is a very simple picture where I put how patients are connected using IoT devices to our app, and how doctors are able to analyze the data that is being uploaded, and the use of AI to make their work process more efficient and more intelligent. So I'm just going to do a little bit of comparison here, as you can see how healthcare settings are in the past, and in the future, we are looking into a lot of accessibility. One of the main reasons why technology plays a very important part in healthcare, we want to actually improve access, and also looking into ways how technology can help to lower the cost in healthcare moving forward. So this is just a very simple, again, I just want to show what it means by connection of IoT devices and having remote monitoring services where our physicians is able to get the data of the patients. For example, if someone is having a chronic illness, because we know that chronic illness are actually it's very much a disease burden. So looking into that, we want to actually help the patient when they are not in the clinic or they are beyond the four walls of the physician. So we will want the patient to be regularly monitored by our doctors, and how to get a much more efficient and accurate data. That's when IoT devices play a part. So we are able to actually do a system assessment, and at the same time, we are able to do e-prescription, and we are able to continue the remote monitoring services, so that patients, again, what the main idea here is, we wouldn't want the patient to actually deteriorate. So when you have intervention, it's actually pretty much very useful, so that you actually minimize patients' condition. So this is part of the IoT devices. We actually have 24 devices that's connected, and we know that there's many wearable devices that's Bluetooth connected. I think Dan mentioned earlier, he's wearing wearable devices to monitor his heart rate and his exercise routine and steps and whatnot. So, but I just want to show these 4 IoT devices, because this is basically what's being used for patients who are having chronic illness. For example, someone who have high blood pressure, so having a BP connected to him, and also having a SpO2 is actually very effective for physician to have a very clear diagnosis of his condition and his medical data. And for example, if someone having a cardiovascular disease, for example, atrial fibrillation, then an ECG will be very appropriate for him, because he's able to at least monitor any abnormalities of rhythm. So let me try to see if you are able to see this video. Is it working?
It's working, yes.
Great. So this is just a very simple overview, like what our EMR is able to
pick up from the patient's data. There's a trend setter. So these are all to provide a much more dashboard overview for the physician. So this is just a simple image that I put here, like you are able to get the patient's vital sign, critical indicator, you are able to get the function test, and also at the same time, you're able to at least have a tracker to monitor the patient's lifestyle. For example, is he working out today, is he exercising? So these are all important data that is actually very useful for the physician in managing patients, especially with chronic illness. So another use of AI, I just want to touch a little short topic on this. I think this was mentioned by Steve too about AI technology for diagnosis of cancer. So when there's an early detection, for example, in this case, I'm giving a very simple one, which is lung cancer prediction, which is using AI capability. So our physicians are able to actually make a much more earlier diagnosis and prevent patients from going and deteriorate further. Another use of AI is also to identify chronic diseases, and in this case, chronic vascular diseases, by using a fundus camera disease recognition. So with this, we are also able to prevent patients from deteriorating further, and this data is able to help the physician to actually make an early intervention. So these are, like I said, examples of using AIs in healthcare and how technology have actually enabled all these things to happen. I just want to share, this is a very interesting, I think one of the speakers mentioned about chat box and using AI speech. So I want to do a very simple demo actually, which I've actually done it earlier, on how AI speech will be very much useful for doctors in moving forward, because it's using natural language processing. So when it's able to connect to a patient and patients actually have a conversation with the AI speech, the bot is able to actually register all this information. So let me just play a very quick one so that we can hear the conversation and how it actually can be translated into a text format. All right?
Be asking you some questions. You can just answer me yes or no. Are you short of breath?
No.
Do you have any chest pain or chest pressure?
No.
Do you have any acute stroke symptoms,
No.
such as numbness of any part of the...
Let me just forward it down. So
Oh, did the doctor raise any concern about this pregnancy during your previous checkup?
No.
Thanks for all the answers. You are suitable for the home recovery program.
So again, this is how we use AI, and in this case, conversational AI speech, to actually help physician to shorten the process of triaging patients. And this is very useful because all the answers are pretty much, as you can see, recorded here and being translated into text. So these are one of the things I would say how the future of technology and how AI will play a part in healthcare.
I am a telemedicine provider who has...
So again, how does technology and Imedic change landscape of healthcare? As I was sharing in this, it's again, like all our other speakers have talked about, we want to accelerate medical accessibility. We want to make sure that physicians, we want to increase the productivity. We're not trying to replace doctors. I mean, they play a very important role still, but what we want is to actually make it more effective, more efficient, and we want to ensure that it can help to even boost doctors and patient relationship. And at the same time, as for the patient, you want them to actually reduce their costs and their disease burden. So I hope I keep to my time of 20 minutes. So this is my sharing on how AI plays a part in our future of technology and how Imedic actually leverage on it.
Thank you very much, Viva. That's another exciting innovation in the field of
Thank you.